Which of the following is most true regarding the evaluation of patients with pelvic pain? A. Ancillary testing can be limited to a urine pregnancy test in most patients. B. Bimanual examinations have been shown to result in highly reliable findings with substantial inter-observer agreement. C. Patients typically localize visceral pain with a high degree of accuracy. D. Thorough history taking is adequate to exclude most life-threatening conditions. E. None of these. Answer is E. None of these. It is rare that any particular finding on history or physical examination is reliable enough to make or exclude a particular diagnosis conclusively in patients presenting with pelvic pain, so ancillary testing, beyond a simple pregnancy test, is commonly required in the evaluation of these patients. The bimanual examination may, at times, provide important information. Unfortunately, however, findings on pelvic examination are somewhat subjective and unreliable and may serve more to localize the process to one side or the other rather than diagnose it or even limit it to the reproductive organs. Although pelvic pain often originates from the reproductive organs, it may arise from any structures that lie adjacent to or course through the pelvis. Visceral pain afferents supplying the pelvic organs have common innervation with the appendix, ureters, and colon. Their significant overlap makes accurate localization difficult for both patient and emergency clinician. A 26-year-old patient presents with right lower quadrant abdominal pain. She states her last menstrual period was 8 weeks ago. Bimanual pelvic examination reveals tenderness in the RLQ and right adnexal area. The patient's vital signs include a regular pulse of 120 beats min and a blood pressure of 110 by 68 mm Hg. Urinalysis is unremarkable, and the urine pregnancy test is positive. What is the most appropriate next test? A. Cervical cultures. B. Complete blood count. C. Computed tomography. D. Magnetic resonance imaging. E. Pelvic ultrasonography. Answer E. Pelvic ultrasonography. The most life-threatening pathology requiring urgent or emergent intervention is hemorrhage from a ruptured ectopic pregnancy. A pelvic ultrasound scan is rapid, especially when using bedside ultrasonography, and is the first step in an evaluation of a suspected ruptured ectopic pregnancy. A 30-year-old woman presents with lower abdominal pain. She has lower abdominal, uterine, bilateral adnexal, and cervical motion tenderness on pelvic examination. She has a negative urine pregnancy test and urinalysis. What is the most appropriate next step in the patient's management? A. Await cervical culture results. B. Obtain a CBC. C. Obtain a CT scan. D. Perform a pelvic ultrasound. E. Treat with antibiotics. Answer. E. Treat with antibiotics. The constellation of uterine tenderness, bilateral adnexal tenderness, and cervical motion tenderness is classically associated with pelvic inflammatory disease, particularly when the pain onset is during or just after menstruation. The diagnosis may be made, however, without the presence of all three signs, and treatment may be initiated with only one sign in an at-risk patient. A 35-year-old woman undergoing infertility treatment presents with severe lower left quadrant (LLQ) abdominal pain and tenderness isolated to the left adnexal area on pelvic examination. The urine pregnancy test is positive, and the urinalysis is unremarkable. Rapid bedside ultrasonography reveals an intrauterine pregnancy with a gestational age of 6 weeks, 5 days, and moderate free pelvic fluid. Which diagnoses should be further investigated at this time? A. Ectopic pregnancy. B. Heterotopic pregnancy. C. Round ligament pain. D. Simple ovarian cyst. E. None of these. Answer. B. Heterotopic pregnancy. Women who are actively undergoing infertility treatment are at increased risk for ectopic pregnancy, heterotopic pregnancy, ovarian torsion, and ovarian hyperstimulation syndrome. What is the leading obstetric cause of maternal mortality? A. Domestic violence. B. Ectopic pregnancy. C. Placental abruption. D. Postpartum hemorrhage. E. Septic abortion. Answer is D. Postpartum hemorrhage is the leading cause of maternal mortality. Within the first 24 hours after delivery, this is usually caused by uterine atony. After 24 hours, the cause is frequently retained products of conception. A 30-year-old woman in the 8th week of her first gestation reports a one-day history of crampy lower abdominal pain and scant vaginal bleeding. Vaginal examination reveals a minimal amount of dark blood oozing through a closed cervical OS. Endovaginal ultrasonography confirms an intrauterine pregnancy of 8 weeks gestation. The fetus has good cardiac activity. What is the most appropriate diagnosis for this patient? A. Incomplete abortion. B. Inevitable abortion. C. Missed abortion. D. Normal pregnancy. E. Threatened abortion. Answer is E. Threatened abortion. Bleeding during pregnancy is common but should not be considered normal. The symptoms and findings in this patient lead to a diagnosis of threatened abortion, which is described as bleeding of intrauterine origin before the completion of 20 weeks gestation, without dilation of the cervix, and without expulsion of products of conception. Patients with threatened abortion may or may not have uterine contractions. An incomplete abortion is the expulsion of some, but not all of the products of conception, which would be a complete abortion, before the completion of 20 weeks gestation. An inevitable abortion is defined as bleeding of intrauterine origin before the completion of 20 weeks gestation, with dilation of the cervical OS but without expulsion of the products of conception. Missed abortion refers to retained prod UCTS of conception after demise of the embryo or fetus. A 30-year-old woman who is 26 weeks pregnant describes a 1-hour history of painless vaginal bleeding after tripping and falling from a standing height. Her vital signs are normal, and physical examination of the abdomen reveals a non-tender uterus with a fundal height 1 cm above the umbilicus. Of the following, which would be the most appropriate next step in evaluating this patient? A. Abdominal MRI. B. Bimanual examination. C. Sterile speculum examination. D. Ultrasound. Answer is D. Ultrasound. Painless vaginal bleeding after the 20th week of pregnancy is suggestive of placenta previa. Pelvic examination, speculum or bimanual, should be deferred until ultrasound has excluded placenta previa as the cause of bleeding.